Let's clear something up right away. If you've been told you have astigmatism, don't panic. You're not alone. And no, your eyes aren't broken. Hi, I'm Dr. Solomon Gould, optometrist and senior eye care director at Pearle Vision. Today, we're going to talk about what astigmatism is and how it's commonly treated. Please remember, this video is for education purposes only and is not intended as medical advice. Always consult a qualified eye care professional. Now let's get into it. Astigmatism is incredibly common, and in most cases, it's very manageable. Some people don't even realize they have it until they get their eyes checked. In fact, about 1 in 3 people has astigmatism. The word astigmatism is Greek. A means without, and stigma means a point. So it literally translates to without a point. Because light doesn't focus to a clear spot the way it should, it just means your eye doesn't focus light evenly, because it's shaped more like a football than a basketball. For most people, this irregular shape is something they're born with. They can also develop over time, or sometimes result from an eye injury or certain surgeries. So what does this actually mean for your vision? It depends on the type of astigmatism. There are 2 main kinds: corneal, which affects the front surface of your eye, and lenticular, which involves the lens inside your eye. Both types bend light unevenly, which can make things look blurry, stretched out, or slightly shadowed. And it can also cause halos and streaks around lights, especially when you're driving at night or looking at bright screens. If you've had an eye exam and seen terms like CYL or AXIS on your prescription, those are measurements for astigmatism. CYL is short for cylinder, which tells us how much correction your eye needs. Axis tells us where the curve is on your eye. To get those numbers, we might conduct a keratometry test or use specialized tools like a corneal topographer that helps us map the shape of your eye. It's painless and uses precise corneal measurements. So how do we treat astigmatism? One of the most common options is glasses or contact lenses. If you wear contacts, you may need a toric lens designed to stay in place and help correct that uneven curve. There are also surgical options like laser correction. That's something we discuss based on your specific needs and goals. If you're choosing glasses, a common option we generally recommend are lenses with high definition optics and anti-reflective coating. Astigmatism can make light scatter more than usual, especially at night, and many patients find that these features help improve clarity and reduce glare. What matters most is that you're seeing clearly and comfortably, and that starts with a comprehensive eye exam from someone you trust. Astigmatism might sound like a big deal, but for most people, it's very manageable. We've got the tools and the experience to help you see better.